Friends, thousands and thousands of dental implants are failing around the world. Why is that happening? Why are so many people having failures with dental implants? Should this worry us? Is it stressful? Does it mean that dental implants don't work? We see many videos on the internet saying, don't get dental implants, don't get bone grafts. In this video, I'll explain what's true and what's definitely not, and why they're misusing this info to manipulate you into making a decision that might not be the right one. Right, okay. Before we start, I want to ask you a question. Do you think the human body is going to accept something that's going to cause it harm? Let's remember something. When we had that ingrown bump, which is a little hair that got stuck there, what's the first thing the body does? It rejects it, it expels it with pus, if you will, with some purulent content, but in the end, it gets it out of the body. Why? Because it doesn't want it there. An infection is the same. It looks for a way to get out of the body. Why? Because we want to expel it. That's the body's function. Now, why is this important? Because if you place a dental implant in the bone, what do you think is going to happen? What do you think your bone does every time a titanium dental implant goes into the bone? The bone grows around the implant and accepts it. That is, it embraces it. If the dental implant were really as bad as they say, do you think your own body, being so wise, would accept it? And not just a dental implant, let's go a bit further. There are even full hip replacements, femur replacements made of titanium, and absolutely nothing happens to the body. So why are they saying that dental implants are bad, that it's not right? Well, because it's marketing. Friends, if dental implants were really bad, your body, which is so wise, the first thing it would do is trigger an immune response very quickly. To do what? To expel this foreign body. Therefore, if your implant is made of pure titanium, there won't be a rejection. On the contrary, your body will accept it and it will osseointegrate. Now, here comes the big problem, and I want you to pay close attention. When dental implants aren't manufactured in a factory that has the clean implant certification or that has extraordinary quality control, the burrs they use to mill the titanium implants can leave metal residues like tungsten, like copper, or some other contaminating metal that will definitely be on your implant. And when they place that dental implant in your body, then there will be a rejection. Why? Because the body will say, hey, the titanium is fine, but I don't want this metal, and out it goes. And then a rejection occurs. Therefore, if the dental implant was contaminated with some metal that isn't titanium, your body definitely won't react favorably and will reject that dental implant. And to that end, this point. If you get those dental implants, they sell you 2 for 1 and super cheap, extremely cheap, suspect something, because there are more and more dental implant companies that have no scientific backing, that don't have good quality control, that are selling implants left and right. And those dental implants can come contaminated since they haven't gone through certification, like Clean Implant, for example, where they guarantee that the implant comes clean of contaminants. And it makes a lot of sense, which is why we're seeing more and more rejected implants. Why? Because there are more and more uncertified companies selling dental implants at very low prices, and then they're placing the patient, and the patient is the one who ends up paying the price because they undergo surgery, and in the end, it doesn't work. Now then, we've already mentioned the part about implant quality, which is very important. Now, what about, for example, the surgical technique? Normally, the surgical technique is very important. Why? Because the surgeon has to know how to place the implant. You have to know how to place it at the correct newtons. Believe me, even if you're the best implant surgeon, you're gonna have failures, and that's normal. But what is normal? For example, in clinics like ours, we have a documented 98% success rate with dental implants. What does that mean? That out of 100 patients, the treatment works for 98, and with the other 2, we have to rethink the treatment. We can reposition the implants, or frankly, sometimes we just can't place them. But 98 out of 100 is a very good probability. Now, why do we have such a high success rate? Well, because we look very closely at the patients we place implants in, and we pay close attention to what I'm going to tell you in this video. So we already mentioned implant quality, which is vital, but the surgeon's quality and the surgical technique are also important. Remember, it has to be someone who has studied implantology. There are specialties like implantology and prosthetics, implantology and periodontics, implantology and surgery. There are several, right? And the point is that this has been studied well and that the planning is correct. If there's no planning, imagine, forget it, there's no way to place a dental implant. If we don't have a dental scan, for example, where we see the bone in 3 dimensions, we have a lower chance of success if we can't see what we're doing. It doesn't mean that having a scan is mandatory to have success in implantology. Absolutely not. But it helps us a lot to be able to see the anatomical structures, calculate, and in some cases, like what we do, we plan the surgery in 3 dimensions to have the least amount of failure possible and try to place the implant exactly where our prosthesis, that is, where our tooth, is asking for it. One thing is where there's bone, another thing is where the tooth is requiring us to place the implant. And that's what the third point is about, which is occlusion. Friends, the bite is extremely important in dental implants. You can be the best dental surgeon in the world, the one who places the best dental implants in the world. If a tooth is placed on that dental implant and that tooth doesn't have a good bite, it's guaranteed to fail. It's very important that the bite is correct. And that's why many times we have to send patients to orthodontics to first correct their bite with braces, with clear aligners, because after correcting that bite, we already have a much more favorable bite and we can place the implants. If we rush to place the implant and don't have the correct bite, it's much easier for those implants to fail. Why? Because they're going to receive loads they weren't designed for. All implants have their indications like anything else in the world. If we place teeth on implants where there isn't a good bite, they're going to receive very, very, very strong lateral or frontal loads, and they're going to cause that implant with that crown to fail. Therefore, having a good bite is super important. So that's 3 points already. Imagine that. First, the implant quality, then the surgeon's skill, the surgical technique, and then the occlusion. If any of those 3 fail, the implant can fail. Imagine the number of implants, therefore, that are failing. Now, let's go to the 4th one, the patient's health. Friends, you don't know how many times I've said it on this channel, but the patient's health is the most important thing. We're placing dental implants in patients who aren't compatible with dental implants, at least for now. What does that mean? If the patient has low vitamin D, they have double the chance of having a rejection or a dental implant failure. If the patient has high cholesterol, high triglycerides, uncontrolled glucose, all of that affects the surgery. Therefore, if we place a dental implant in a patient who isn't healthy, we increase the chance that their body isn't ready to accept that implant and the implant is lost. Now, whose fault was it there? Well, definitely the surgeons, because they didn't study the patient well. We have to request blood tests. I told you many times which tests we request to make sure the patient is compatible with the implants, and thus we reduce the amount of risk there is in losing the implants. Number 5, and it also has to do with the patient's habits. Friends, if your patient doesn't stop smoking, your patient likes alcohol a lot, if your patient likes to go around chewing things, opening things, they're obviously going to have more risk of losing the implants. Therefore, we can't place dental implants in patients who smoke and patients who don't take care of themselves because it'll increase the risk of implant failure, the risk of a dental implant not working in the mouth. And that definitely increases the probability that we'll see more losses in dental implants. And that's why the famous aunt comes along and tells you, no way, son, those dental implants are no good. I got 4 and only 2 worked. Wait, but the aunt has hypothyroidism, her glucose is through the roof, the aunt smokes. Obviously, it's not going to be the same as in a healthy patient. Therefore, the patient's health and the patient's habits are very important. Maintenance, okay, great, okay. And point number 6, but not least important, friends, did you know that dental implants can be lost after they're placed? And this can be 1 year, 2 years, 10 years later. Why? Because many patients don't get maintenance done, and this has to be every 6 months. Now, what has to be done when you go to the dentist for implant maintenance? Number 1, an X-ray. We have to see how that bone is doing, how what surrounds the implant is. Imagine if we don't know how what surrounds the implant is, how can we make this implant last longer? Therefore, we have to check that. Number 2, we have to check the bite. The implant has to be very well in the bite after placement because sometimes teeth move and there can be interferences there. Therefore, we must check every 6 months that the bite isn't traumatic and that it's fine. Number 3, and very important, dental cleaning isn't done with just any device for cleaning teeth. Cleaning a tooth isn't the same as cleaning an implant. The very famous scaler with the metal tip can scratch that implant, and those little scratches, which for you might be harmless, for bacteria are beautiful channels to be able to live inside there. Therefore, to clean a dental implant, it should always be done with a tip made of a plastic called PEEK, polyether ether ketone. This tip is special because it doesn't scratch the implant, but it's strong enough to remove plaque from the implant. Imagine how important this is. If we scratch the implants, we can induce or cause periimplantitis because of the bacteria that get trapped where we scratch the surface of the implant or the abutment. Super important. So friends, of course you're hearing on the internet that thousands of implants are being lost. And yes, it's happening, it's true, but I want you to know it's not happening to everyone, and it doesn't have to be your case. If you follow these 6 points I mentioned, and there are other more specific points to check too, but especially these 6 points, it'll be much more likely that your surgery is a total success and your implant lasts for many years. Remember, point 6 is very important: maintenance. You don't just get the implant and leave forever. You have to go back to your dentist so they can check on that implant and your bite. So friends, don't get carried away by what you hear on the internet. There's always a good side and a bad side, and for that reason, it's important that you also hear the positive side. If you like this video, share it with your friends. If you're gonna get a dental implant and have doubts, this video will help you a lot. Don't forget to subscribe to this channel because this information is for your health. Like the video, and I'll see you in the next one. I hope you're doing very, very well.